Hey, everybody, I'm joined here by Kanika Lewis. She is a nurse specialist with the BC3NP program with the state of Michigan. Kanika, thank you so much for joining us.
Hi, thank you for having me.
So let's just start out. Tell me what the program is and what BC3NP stands for.
Sure. So BC3NP is the Breast and Cervical Cancer Control Navigation Program. We're a federally funded program out of the CDC. And our goal is to provide breast and cervical cancer screening and diagnostic services to low-income, uninsured, and underinsured individuals across Michigan. So we cover all of the counties.
So when you say services and provide services, you're talking specifically about people who cannot financially afford to get this type of care.
Absolutely. So one of the greatest barriers to getting any type of medical care is the cost. And we often, for our program, we actually have a higher income threshold when we talk about low income individuals, so we can cover more people. There are a lot of people that have insurance, but it doesn't cover everything. It might cover your screening, but it might not cover your diagnostics, things like that. So we come in and we offer our services to pay for those services actually and help navigate clients. Because another thing is not just the cost, but where do I find these people to provide these services for me? So we also help to navigate people to services in order to get those screenings that they need.
That's excellent. Okay, so if I am a low income person, I guess how do I know whether I qualify, or how do I find out?
Well, one thing you could do is go to our website, www.michigan.gov/BC3NP. On there, it has information on your eligibility. You can also email us at bnp@michigan.gov. And in that way, we're able to take some of our team members, ask some questions, find out if you're eligible, and then move you through the program. But in general, we serve those who are at 250% of the federal poverty level or below, which with Medicaid, it's 138. So that means that we offer a lot more in regards to income. Uninsured individuals, or those who are underinsured, which means I have insurance, but it may not cover everything. Or my deductible is so high that if I'm going to have to pay for it, I'm probably not going to get the service. We don't want that to be a barrier. So we would assist in that case as well. We serve 40 to 64 when we're talking about breast cancer screening, because that's when the average person should start screening. But we also can lower that age for those who are high risk. And then with cervical cancer, it's 21 to 64, whether you're average or high risk. So there's a lot of variation. But we're there to serve as many people as possible.
Excellent. So so to be clear, it sounds as though you have expanded the financial level so that more people can be included beyond just the federal poverty level. Is that correct?
Absolutely. Absolutely. Yes.
So breast cancer is really kind of the focus that we're on right now. With regard to breast cancer services, talk about, I guess, the diagnostic and treatment services that you have available for patient or for individuals.
Sure. So national guidelines tell us that at 40, and the average person should start their breast cancer screening, which is a mammogram. So we cover the mammogram, we cover the office visit and the clinical breast exam as well. If someone is high risk, and that could be for a number of reasons, but if they're high risk, they may need to start screening as early as 25 with an MRI, and we can assist with that.
I think you just froze there. I'm gonna give it a second. Oh, go ahead.
You got it. Okay. If we did do a screening and we found a diagnostic, an abnormality, then we're able to pay for diagnostics such as additional mammograms, ultrasounds, biopsies, anything. If we find an abnormality, we follow you all the way until we get a final diagnosis. And then in some cases, when if someone is diagnosed with breast cancer, we do have a special Medicaid program that also has that higher income threshold than regular Medicaid. It's full coverage, and it also allows us to cover breast and cervical cancer treatment. In that case, the eligibility is a little bit different than our program, but it's always an option. And when it's not an option, our local coordinating agencies that are all around the state assist in finding other resources for treatment.
Wow. So really, I mean, and to the point that you made earlier, finances, cost should not be an impediment to care. I think that's a tremendous statement. I think that's a really exciting element to your program. So just to be clear, there are times, for example, it's stated across the board that mammography, screening mammograms are supposed to be free, covered under Affordable Care Act, et cetera. But in your particular circumstance, you cover the follow through as well if a biopsy is needed. And then if there's a subsequent diagnosis, I mean, you really cover the entire spectrum.
Absolutely. And we also understand the transportation, especially we have a lot of rural areas in Michigan. We do offer transportation vouchers to kind of help people get to those appointments so that we do our best to remove as many barriers as possible, as well as language translation services and whatever we find our clients are missing, we try our best to kind of fill in the gaps. But our primary goal is to be that payer and that navigator to get them to services. Mm-hmm.
Cool. So do you also offer, I guess, counseling services or anything beyond paying for the services? I mean, not that that's not awesome by itself, but what other services might be available?
Counseling services, no, but during the office visits that we pay for, clients are educated on their breast health, understanding breast awareness. A lot of the times people don't come to providers about an abnormality unless they see a lump. That's what we've learned.
Mm-hmm.
But there are plenty of other symptoms that you may find that lead to breast cancer or are telling us we have breast cancer that we don't pay attention to. And research has shown that in most cases, if you see something other than a lump, it takes you about 3 months more before you decide, maybe I should go talk to a doctor. And we don't want that.
Yeah.
So in those meetings, in those office visits, they could talk about, understanding nipple retraction and what is your skin supposed to look like? And what if there's pain? All of these other symptoms that we're just not always educated on. So it really offers that opportunity. And then for our high risk clients, there's more offered in office visits to discuss their risk and how they can better lower their risk or just look out a little bit more, be a little bit more diligent about their breast health.
Now, your services, are they county specific? How do you get engaged with the program?
Mm-hmm. So we have local coordinating agencies. So we have hubs across the state and we have 14 of them, and those 14 cover multiple counties. So every county is covered. There are providers as far as Michigan stretches. And so we definitely redirect clients according to their hub. And then that hub manages who they see, making sure bills get paid and helping to navigate them when they need to.
And so when you say who they see, is there a specific provider list or preferred providers that is hospital systems, clinics, physicians? How does that work?
We have providers that we work with who are our partners, definitely health systems as well. And what we find is a lot of people miss out on getting their screenings because they don't regularly go to a primary care provider. So we also have the ability to link them with a primary care provider who can follow them throughout the process. So yeah, we offer that opportunity as well to get them back in the system of having a primary care provider and taking care of all of their healthcare needs.
Excellent. All right. Is there anything we didn't talk about that you want to bring up about the program? What's the best way for people to get a hold of you or engage with it, figure out if they're eligible?
Okay. I would say go to BC3NP at michigan.gov. That's our email. And we have great staff that kind of helps navigate people through. But if you just want to read about the program, www.michigan.gov/BC3NP.
Okay, yeah. So if you Google BC as in cat, 3, N as in Nancy, P as in Paul, you will find it, BC3NP Michigan. If you just Google that, you'll be able to find the page and get to it and identify how to plug yourself into the services.
Absolutely. Yes. They have a tab that talks about eligibility and where do I go, and you're on your way.
All right. Well, thank you so much for talking about this and and talking with us today. I really appreciate it. And, have a great day.
You too. Thank you so much for the opportunity.
Take care.